Ed Naval from San Diego has been a nurse for 13 years, 6 in the ICU. He's a proud Filipino-American who comes from a long line of healthcare workers.
Helping and healing the sick was something that I've always wanted to do. It was something that my mom did, my mother-in-law did. It's kind of like ingrained in my genes.
But during the pandemic, his passion to serve others meant being exposed and possibly exposing his family to a virus that could kill.
We were scared. I was scared. I literally told my family, you know what, I might not be able to come back healthy, or, we did what a lot of people were doing. We were sleeping in separate rooms. I slept in the garage for a month, not knowing what would happen. My kids were like they were afraid that dad might not come back or dad might die.
A study done by the Bulacan Center for Filipino Studies finds those feelings are not uncommon and have led to anxiety and depression for 1 in 4 Filipino-Americans during the pandemic. 18% of nurses in California are Filipino, and 1 in 3 are frontline workers. Dr. Robin Rodriguez, the director of the Bulacan Center, says their study went beyond statistics.
But we knew that that wasn't going to capture the story and the real, the human face of this impact of this pandemic. So that's why we complemented the survey with these focus group sessions, or what we called talk story, or in Filipino, kwentuhan sessions. And they're really, really just heart-wrenching.
Rodriguez says the story of one young woman living in a multi-generational household, something not uncommon in Filipino families, has stayed with her.
For our family, it's kind of like a wolf is at the door. I mean, that was really just striking, to say the wolf is at the door, this sense of danger. And then that, creating all sorts of anxiety and depression.
Rodriguez and Naval hope studies like these lead to more mental health resources for Filipino-Americans who are disproportionately risking their lives for a living.
It took its toll, and that's part of the reason why a lot of the nurses did suffer some general anxiety, PTSD. So the biggest challenge now is just what are we going to do about it?
Kitty Alvarado, KPBS News.